Okay, let us test ourselves. So these are the muscles that you have to name. The muscle that lifts the eyebrow, that knots the eyebrow when you are angry, that lifts the upper lid, that pulls the eyeball forward and is paralyzed in sympathetic paralysis called the Horner syndrome. Actually, you block the sympathetic trunk to increase blood supply to the ischemic upper limb by injecting at the root of the first rib and blocking the stellate ganglion, the inferior cervical and the first thoracic sympathetic ganglion. The symptoms are, the signs of this blockade are called as Horner syndrome, and they are paralysis of levator palpebrae superioris, means ptosis, paralysis of dilator pupillae, therefore there is constriction of pupil, which is miosis, the paralysis of the sweat glands of that side, which is anhidrosis. You recognize the anhidrosis by pasting starch iodine on the forehead and exposing the face to warmth. The side on which the sweat glands are paralyzed or there is absence of sweat, which is called as anhidrosis, remains white, while the opposite side, the starch iodine, converts into a purple color. So that is the test of anhidrosis, ptosis, meiosis, anhidrosis. Then this muscle which pulls the eye forward is also supplied by the sympathetic system. It's the part of the lacrimal part of the orbicularis oculi. The palpebral part is on the eyelid. The ocular part of orbicularis oculi is on the remaining of the orbit, and the lacrimal part squeezes the lacrimal sac so that the tears can drain into the nose, and it also has a part which pulls the eyeball forward. This part of the orbicularis oculi is called as the Horner's part, and therefore this paralysis leads to enophthalmos. The eyeball moves backwards, and the muscle is named as Horner's muscle. So ptosis, meiosis, anhidrosis, enophthalmos, and flushing of face, because that side face blood vessels dilate, therefore that side turns red, whereas the other side remains pale. Therefore this is called as flag sign. So remember this very, very important muscle, enophthalmos, causing paralysis of which causes enophthalmos, the Horner's muscle. So when I say pull the eyeball forward and you say it's the Horner's muscle, this much you should be prepared in the viva for. So which muscle squeezes the lacrimal sac? Lacrimal part of the Horner's muscle. Then muscles that move the eyeball move up. Actually, the eyeball is a sphere. So on the side to side axis, it can elevate or depress. On the anteroposterior axis, it can intort or extort, and on the supero-inferior axis it can look outwards and look inwards. So all the muscles must act in combination to produce these movements. So here we have tried to show you the orbicularis oculi, the muscle that pulls the eyeball forward, and the muscle that squeezes the lacrimal sac so that it drains into the nose. And you may be asked which combinations this may produce. So here is a chart. The muscles of the eyeball extrinsic are superior rectus, inferior rectus, medial rectus, lateral rectus, and superior oblique, inferior oblique. So this, let us say this is 16, this is 17, this is 18. So you have to simply say the superior rectus elevates. You have to write E here. It pulls inwards, so you have to write M here. And it basically would intort, therefore you have to write I here. So the first row you have to say elevates, you have to write E here. You have to write medial here, M, and it intorts. You have to write I here. That's how you have to fill all these columns, right up to 18. So 18 MCQs are in this table. So you have to fill from 1 to 18. And let's see whether you can do it. If you can do it, that means you will be always able to do it. So then you have to remember how these muscles are named. Supposing we say levator labii superioris elec nasi. This means levator means elevate, labii lip, superior is superior, plus ala of nose. That's how you name the muscles. Not a very long and difficult name to say, but very easy to understand, because just by the name you can understand what it is doing. So upper lip up, name the muscle. Lower lip down, name the muscle. Angle of mouth up, name the muscle. Angle of mouth down, name the muscle. From zygomatic to upper lip, from zygomatic to angle of mouth, name the muscles. Muscles that open the jaw, muscle that opens the jaw, muscles that close the jaw, muscles that cause side-to-side movement of jaw. Of course, two muscles will move the jaw to the right and two muscles will move it to the left. Name these muscles. Pushes food from the vestibule. Now this vestibule is the cavity between the cheek and the teeth. So the tongue has pushed the food out into the vestibule and the vestibule pushes it in. And every time this food is moving between the teeth, upper and lower teeth, as the jaw, lower jaw and lower jaw is closing and opening against the upper jaw. So this keeps on moving the food from outside to inside and inside to outside. So which is that muscle that does push food from between the cheek and the teeth to inside the teeth? Name starts with B. Hope you can remember it. Which is the muscle that pushes these are the outside muscles coming from outside. Pushes the tongue forward, GG, backward, SG, up, PG, and down, HG. Okay. G always means glossus. So forward, genioglossus, backward, styloglossus, up, palatoglossus, down hyoglossus. And these are the intrinsic muscles that change the shape of the tongue side to side on a supero-inferior axis. This muscle will become short and this muscle will become long, will be stretched. That will cause the side to side movement. Now roll up, angles roll up. So this muscle will become short and this muscle will become stretched. Same way, now this muscle will become short and this muscle will become stretched. Rolling up, this muscle short and this muscle stretched. Rolling down, this muscle short, this muscle short, and this muscle will become long. So that's how the shape of the tongue can change. Now then you can see these diagrams and the actual placement of all those muscles. F name, T name, O name, OC, all the parts, LLS, Z mind, Z mage, LAO, DAO, elevation and depression of angle, OO, as O oculi, same way O, oris, DLI, depressor levi inferioris. And there's a muscle here which is also called as mentalis. You get marks if you can tell us the action of mentalis. Then everything covered by P. This is the anterior belly of this, coming from mastoid inner surface, winding around the hyoid, getting attached to the mandible, dividing the floor of the mouth into external to the mylohyoid into submental and digastric triangles, this muscle T. Then the muscle that you see forming the floor of the mouth, which we'll say like this, and muscle which closes here is MA. Okay. We'll change the color here. This is MA. I'll write MAS. Okay. Then this is muscles SM. This is OM. This is TR. Then this is the ligament coming from the styloid attaching to the mandible. Stylomandibular ligament. This pulls the ear lobe backwards, upwards, forward. So this is AP, AS, AA, these muscles, AP. So these are the muscles. I hope and wish you the best of luck to score as high as possible in this test. And especially remember the Horner's syndrome.